welcome to Safe Sprouts TV, the place to be where we chat all things child first aid and safety. I'm your host, Kat Mason, and it's First Aid Friday again, woo! And today's question comes from Lauren. She says, "Hi Kat, one of the babies in my mum's group has just been diagnosed with FPIES. I think she's about 10 months. Can you go through this with us for your First Aid Friday?" Well, absolutely, Lauren. FPIES is not a topic that many people may be familiar with, but it's popping up more and more in conversations I'm having with parents. Now, FPIES. F what? Okay, so FPIES stands for Food Protein Induced Enterocolitis syndrome, which is a rare but important condition that could affect your baby. Today we're going to break down what FPIES is, how to recognize it, and what to do if you think your child's affected. First things first, what exactly is FPIES? Well, FPIES is a type of food allergy that usually occurs within the first 2 years of a child's life, and it primarily affects the digestive system. Now, unlike the typical allergies that cause immediate reactions like hives or swelling, FPIES causes delayed symptoms, usually within 2 to 4 hours after eating the trigger food. For most infants, the most common triggers are cow's milk, soy, eggs, chicken, and grains like rice or oats, just like this little one from Lauren's mother's group. But it's important to know that FPIES can be triggered by virtually any food. It's hard to know just how common FPIES is because it's under-recognized and super hard to diagnose. However, the Australasian Society of Clinical Immunology and Allergy, or ASCIA, report that in the first 2 years of life, around 1 in 7,000 children have FPIES, with this number on the rise. So how does it present? In FPIES, the body reacts to certain proteins in food as if these proteins were harmful invaders or something. This then leads to inflammation in the gut, causing a whole range of symptoms. And these symptoms can include repetitive, profuse, or projectile vomiting, and some infants can become pale, floppy, and cold, and sometimes diarrhea can occur many hours after. The diarrhea, along with the projectile vomiting, can also lead to dehydration, which in a real little one can become a medical emergency. If you suspect your child is having an FPIES reaction, it's important to take action immediately. If your child is vomiting, but it's not too severe and they're managing to keep down fluids, calling up your family doctor or even using a virtual telehealth service who specializes in pediatrics is probably the way to go. Depending on the situation, you might simply be advised to keep giving fluids to maintain hydration, or you may be prescribed some special mouth wafers or ondansetron to help control the vomiting and prevent dehydration. But if your child is vomiting severely or seems very cold, pale, or floppy, this warrants a trip straight to the ED. Dehydration can happen super fast in kids, and the younger they are, the more dangerous this can become. FPIES can also mimic other really nasty life-threatening conditions like sepsis, so it's really important to rule out these more sinister causes too. I also want to clarify again that FPIES is a different type of allergy to the ones you see causing the skin symptoms and breathing issues. So there is no role for the use of antihistamines or adrenaline autoinjectors such as EpiPens in an FPIES reaction. Making an FPIES diagnosis can be quite challenging. It's usually made based on your baby's reaction history and symptoms. Some common allergy tests like skin prick tests and patch tests aren't useful for diagnosing FPIES. During the initial reaction, blood tests may be ordered to look for other conditions that have similar symptoms to FPIES, such as infections. When it's not clear whether your child has FPIES or when trying to figure out if they've outgrown it, doctors might recommend a medically supervised oral food challenge. This is where your child is given small amounts of the suspected food under close medical supervision to see if it causes a reaction. Currently, the only management option for the prevention of an FPIES reaction is to avoid the trigger food. And thankfully, most children will only have one food trigger for FPIES. And in other good news, the long-term outcome for FPIES is amazing, and most kids will outgrow FPIES before they start school. Whew! A plan for when and how to introduce the FPIES trigger foods will be determined by your child's allergy specialist. This may be done either as a medically supervised oral food challenge again, or if recommended by your allergy specialist, a reintroduction of the triggering food at home. So in summary, FPIES is a rare type of delayed food allergy that affects the digestive system. It's caused by ingestion of a trigger food, after which digestive symptoms appear between 2 and 4 hours later. If your child has persistent vomiting or is cold, pale and floppy, they need to be taken to the emergency department immediately to manage dehydration and rule out other nasty conditions such as sepsis. Management involves avoiding the trigger food, and luckily most children outgrow their FPIES by the time they start school. Thanks for watching, and don't forget to like, subscribe and share if you found this helpful. And if you have a question or a topic that you would love covered, send it through to hello@safesprouts.com.au.